My name is Clark Boccone. Last name is pronounced Boccone, but anything close is fine. I work at New Life Associates. I'm an obstetrician gynecologist, or OBGYN. I work in 2 locations, mostly here at Danville at our main location, but also we have an office in Brownsburg, Indiana, where I work there. I do entire women's health care, including obstetrics, so taking care of pregnancies, as well as gynecology, so taking care of other women's health care issues. Youngest patients, I think I've had 12 or 13-year-old patients. Most patients start seeing me somewhere between 15 and 18 years old. They're usually referred either from their family doctor, their pediatrician at that age, usually for menstrual issues, sometimes for birth control issues. So I look at the physician role as being a little different as how it was classically, a couple decades ago. As more of myself as more of as an educator, sort of that link between what's out there in medicine right now and what the patient knows. And so when the patient comes to me with an issue, here's what we know about the condition that you're talking about. Here's what we know about the treatment options that are out there. It's very rare that there's just one pathway for treating some problem. There's often options for where you go. And so that I've considered my job to educate the patient on here's what you've got, here's the treatment options, here's the implications of those treatment options. Now let's decide how we're going to go. So it's a working relationship between me and the patient, and my job is the educator that's supposed to be the expert in the area, informing the patient how to go. I think the biggest thing now is a lot of screening tests revolve around family history. So when you come in and when you talk about your family history, the big thing we're talking about now is breast cancer screening, like, moms, aunts, grandmas, not just on mom's side, but on dad's side. So if your grandma on your dad's side had a breast cancer and her sister also had a breast cancer, that suddenly raises my patient's risk for having breast or ovary cancer. And we're doing all these genetic screening tests based on family history. So learning about family history, and I'll often joke, or sort of semi-joking with the patient saying, hey, next time you're together with the family at Thanksgiving, pull all the ladies aside and talk about medical history, because a lot of people don't like to talk about their medical problems, right? And just have a frank discussion about that, because that helps in your care with your conversation with your doctor. So that's kind of a big one.